Paul Stubblefield considers himself one of the luckiest people alive. He has a wife of almost 50 years, beautiful grandchildren, and is known all around Hamilton, Ohio as the guy who has won trophy after trophy for his seemingly never-ending restoration work on this rare 58 Chevy Impala that's stored in his garage.
I've been fooling with this thing for about 13 years.
But Paul almost lost it all, and his life when he recently suffered an early morning heart attack at home.
He had a burning, and he thought it was something he ate.
It was like a burning in my chest and pain. I mean, it's hard to just describe. You know?
Gloria Stubblefield knew something wasn't right and had a feeling this was no ordinary illness. She knew Paul, who admittedly ate too much junk food, has had a lot on his plate of late and had been deeply saddened by the recent death of Gloria's mother. For years, the couple has also spent a great deal of time and energy lovingly and willingly helping the grandchild, Jared, who faces the challenges that autism can present to any family, including making sure on certain days he catches the bus first thing in the morning. But before Gloria went out to run some morning errands the morning of Paul's heart attack, she decided to ask her husband a question that she wasn't sure she wanted to hear the answer to.
She asked me, "You think we ought to go to the hospital?" I said, "I think we better go."
When he was ready to go, I was ready to call 911. I knew he was in trouble.
Gloria immediately took Paul to nearby Fort Hamilton Hospital, and they determined very quickly he was having a major heart attack. They prepped him for surgery and called Dr. Imran Arif, an associate professor of medicine in the cardiovascular diseases division at the University of Cincinnati.
It was 100% blocked. We took the patient emergently to the cath lab and ultimately found a blocked artery that was causing his heart attack and opened up the blocked vessel less than 30 minutes of his presentation in the hospital. And he made a remarkable recovery after that.
Dr. Arif says Paul's story is becoming all too common. He says studies now show that most heart attacks happen between 6 a.m. and noon. Why? He says it's too early to tell, but studies suggest cortisol levels peak during this time, and sudden movements may cause plaque in the arteries to rupture. Cortisol is also known as the stress hormone. In other words, the body can go from resting comfortably directly to the stresses of everyday life very quickly from the moment some people wake up.
The traffic, the hassle to get to work, the stress of work, somehow or the other plays a role where they may lead to the rupture of that small, insignificant plaque sitting somewhere and eventually causing a heart attack.
Dr. Arif says while some people may just be more prone to heart attacks, the best thing anyone can do is try to prevent those risk factors to the best of their ability. That includes living a lifestyle with a proper diet, exercise, and as little stress as possible.
So if you smoke, you should not be smoking. If you have high blood pressure, control your blood pressure. If you have diabetes, control it aggressively. If you have cholesterol problems, control it. If you have family history of heart disease, you should have your regular periodic checkups.
Paul and Gloria acted swiftly and went right to the hospital when they thought something was seriously wrong. And they both believed that decision, along with the correct diagnosis from an alert medical team, probably saved Paul's life. Anyone who suffers from any of these heart attack symptoms should keep the story of Paul Stubblefield in mind, and perhaps especially if those symptoms happen early in the morning.
I'm so thankful. Everybody did everything right.
They went about their work perfect. I owe them people, you know.
For more information on heart attacks and all of your health news, you can always log on to healthnews.uc.edu. For an appointment with Dr. Arif or another UC physician, call 513-475-8263 or visit ucphysicians.com.